Everybody, and welcome back to Yoga for Athletes. In the last 2 weeks, we've talked about the foot and the ankle joint. This week is all about the knee joint. And for athletes like us, the knee joint is often a commonly injured joint. And when you look at the structure of it, it becomes pretty clear why. This joint is managing the load acting on the body, the whole upper portion of the body. And for sports where we have load acting external to the body, like skiing, ice skating, soccer, where you have quick direction changes, puts a great deal of demand on this joint, kind of the lower half of the body. So let's look at the structure of the skeleton first, that component of the knee joint. The knee joint is called a saddle joint, and it has to do with the shape of it. If you look at the top of the tibia, the lower leg, the tibial plateau, it's covered in this connective tissue called a meniscus. You have one on either side, and the meniscus helps create this saddle shape, a groove that the femur, the ball of the femur, just sits inside of. And as the knee flexes and extends, these bones articulate against each other, and that groove kind of helps the knee stay in alignment. It keeps the two leg bones, the upper and the lower leg bones, in alignment. There's one other really important groove here, though, to consider. You have the patella, the kneecap, and notice how just on the inside of the kneecap here, you have this little notch. Well, that notch sits perfectly inside a groove. I'll just move that out of the way and you can see it sits beautifully inside this groove inside the bottom of the femur. Now, one injury that can happen sometimes because of overdeveloping the muscles on one side of the patella relative to the other side, you can actually cause the patella to deviate out of that little notch. And when that happens, the bone starts to rub, you get inflammation and pain. That's called patellofemoral syndrome. But let's go back again to looking at the structure of the knee. So it's incredible how much load is on this joint, and really what's keeping these bones together are these ligaments. So ligaments is very strong connective tissue that attaches bone to bone, and there's some pretty notorious ones in here. If you're familiar with knee injuries, you may have heard of the posterior and the anterior cruciate ligaments. So the job of these ligaments is to keep the femur and the tibia from deviating away from each other. It keeps these two bones in alignment. It keeps them from moving fore and aft away from each other. And then you have the lateral side. The lateral collateral ligament attaches the fibula to the femur. And then this one, very commonly injured, especially among skiers, the medial collateral ligament, which attaches the tibia to the femur. And these, the lateral ligaments, keep the femur and the tibia from deviating laterally or sideways. Really, really important. So just these pretty, relatively tiny pieces of tissue are holding the whole thing together, and at the same time allowing it to have its incredible range of motion. So if we go to the knee joint, let's look at some movements here. So we have knee flexion. That's facilitated by all of these powerful muscles in the backside of the leg. So gastrocnemius, those are your calf muscles, and of course the hamstrings. So when these muscles contract, they pull on their attachments on the lower leg bone, from the anchor point here at the bottom of the pelvis, and that is what flexes the knee joint. Similarly, when we have extension, now this will be familiar to all your quadriceps. So why are they quadriceps, you might be wondering? Well, there's 4 of them, but one of them is hidden. So we have the rectus femoris, and what's different about this one is not only is it part of knee extension, but it also is part of hip flexion because of how it attaches to the pelvis. But if we get behind that one, here is the 4th quadricep, the vastus intermedius. You have the vastus medialis, meaning the kind of the midline of the body, and the vastus lateralis, the lateral, the outside part of the upper leg bone. So when these muscles contract, they pull here on the patella, and that because the patella is also anchored down here by a very powerful piece of connective tissue that we don't see in this particular image, to the tibia that helps straighten the knee joint.
Hello, my name is Dr. Joaquin Barrios, and I'm a physical therapist and knee biomechanics researcher. Today I'll be discussing biomechanics and functional movement of the knee. Tibiofemoral anatomy allows for 2 degrees of freedom, sagittal plane flexion and extension, and provided the knee is in some amount of flexion, transverse plane internal and external rotation. For sagittal motion, the knee can typically flex to at least 130 degrees, limited primarily by soft tissue approximation of the posterior thigh and lower leg muscles. For extension, the knee can typically extend past neutral around 5 degrees, limited mostly by bony congruence and capsulo-ligamentous tissue stops. Sagittal motion occurs about a medial-lateral axis of rotation near the level of the femoral condyles. This axis of rotation migrates posteriorly relative to the tibia with knee flexion, and migrates anteriorly with knee extension. For the transverse plane, available motion increases with greater knee flexion. In general, more external rotation range is seen than internal rotation range, with total rotation at 90 degrees of knee flexion being around 40 degrees. Essentially, no transverse motion is seen at full knee extension due to...
Okay, so just a little bit of geeky talk there about the ways the knee can move, but we will not linger on that. Because really the important thing to understand as athletes is the knee is built to withstand a great deal of force, but for athletes, we tend to specialize. Our movement patterns can be repetitive, which means we may strengthen one side of the joint action more than the other, and we can throw things out of alignment. And that's when we make ourselves a little bit more prone to injury. So I'm just going to go over 2 more motions here. We have the medial rotation of the knee joint. So that has to do with these muscles that are on the inside of the femur contracting. And when they do that, they pull on the tibia and it rotates inward relative to the femur. And then lastly, lateral rotation. And so lateral rotation is coming from the bicep femoris and the bicep femoris long head. And when these muscles contract, it's kind of crazy when you look at it here. Their attachment is the fibula, this little anchoring point, and then here, the bottom, the ischium of the pelvis. And when that tightens, it pulls the tibia outwards. It externally rotates the tibia relative to the femur. So you could just imagine if these muscles, because the repetition of your sport demands that you're constantly internally rotating at the leg, Maybe these muscles are underdeveloped, and the muscles that are internally rotating at the knee joint are overstrong. That's going to change the mechanics of the knee joint. So what yoga can do is it can restore the balance, the health, the optimal alignment of your knee joint. So again, one more quick view, kind of looking at the whole thing. It's just an incredible joint. Got without the muscles, so the saddle shape of the joint. And then we've got all this really powerful connective tissue that keeps the bones aligned, the femur over the tibia. And then we have all of these complex anchoring points for the muscles and the ligaments that when the muscles contract, they pull on the bones and they can move the knee into its various orientations. But again, last point, really driving this home, as athletes, if we overdevelop the muscles on one side of the joint and not as much on the other, it will actually pull these bones out of alignment, and that can cause some problems. One problem, osteoarthritis.
Hello, 50% of all people in their lifetime.
So I'm just going to back it up here. So I know this looks horrendous, but what's happening here is the articular cartilage on the end of the bones that's supposed to provide this smooth gliding surface. Over time, just wear and tear has caused little traumas to the articular cartilage, and then it just starts to degrade, and then this becomes really painful in older age. So one way we can stave off osteoarthritis is making sure that we support the knee joint's health so that the bones glide smoothly against one another instead of there being more pressure, compression on one side of the knee than the other. So there we go. There's a really quick look at the knee joint, the structure of it, the ways that it can move, and now let's get into our yoga practice. Hello and welcome back to your yoga practice class number 3. In today's class, we're going to focus on the health of the knee joints. This one is near and dear to my heart because 2 years ago, I sustained a big knee injury. I ruptured my ACL, anterior cruciate ligament, and I also injured the posterior lateral capsule. And it took a long time to rehab, but a lot shorter than most. I was able to avoid surgery, which was awesome. And I really credit my practices, both physiotherapy that I was doing, training in the gym, and of course my yoga practice with that awesome quick recovery. Only 3 months off snow and no surgery. So today I want to share with you everything that I learned about that injury rehab process, and in particular, a series of poses that are going to be awesome for your knee health. Now the first is a series called Pawanamuttasana, which means joint lubricating exercises. And this is an ancient practice. It's going to look really easy, but I promise you, this is a really beneficial, gentle practice to maintain the health of the tissue inside your knee joint. So we'll begin by coming into a posture where your hands are behind you and you're supporting your upper body weight, and then just extending your leg in the air. Full extension of the knee joint, full flexion. And doing this first of all where you can see it. So if possible, having a look at the knee and really being conscious about getting the knee to track straight. So all of us, especially athletes, we tend to specialize the body. We specialize building certain muscles, overdeveloping them and underdeveloping their counterparts to condition our bodies to be perfect for the sports we do. What yoga does is it teaches us how to have optimal full range of movement in the joints and optimal alignment of the body so that we can move any way we want. But it does require some conscious practice. We'll switch to the other side again, really looking, and what I'm looking for is the middle of the kneecap aligning right with the center of my ankle as I flex and extend the knee slowly. So why this is beneficial, inside joints, like the knee joint, you don't have the normal circulatory system to bring oxygen and nutrients to the tissue and to remove the metabolic waste products. And so the way that your body does that is through a fluid in the joint called synovial fluid. And the synovial fluid moves around by moving the joint through its full range of motion. As you do this, you might notice your quadriceps are firing up. They may be getting even a little bit tired. Just a few more times doing this, doing it with real attention to making the movement smooth and straight, making note of any shimmies or wobbles, and then bringing that foot down. Next, we're going to recline onto our backs. Extend the right leg flat against the mat. And then bringing your left thigh up into the air, drawing small circles in the air, isolating this rotational movement just at the knee joint. Now I do this slowly without any weight bearing whatsoever, not even wearing shoes. The knee will allow a certain amount of rotation, but not very much. It's not a great idea to over push rotation in the knee. So as I do this, I'm really aiming to keep the kneecap in more or less the same orientation, not changing the direction of the rotation. Drawing a circle in the air. And then switching to the other side. So holding onto your right thigh this time, rotating the leg. Lower leg bones. It's interesting to me. I notice my body has a hard time coordinating this movement. It's an odd one, something that I don't really do. But again, the goal is just to move the synovial fluid around inside the joint so that that joint tissue can be really healthy. And rotating the other direction, there's an old saying that says, if you don't move it, you lose it. This applies more for older people. And it's true. If you stop using your joints through their full range of movement, or if you over-specialize, using some joints more than others or using them always in the same way, your body will permanently reorganize itself in that restricted movement pattern. So we want to move it in odd ways every now and then. Okay, now we'll need either a wobble board or rolled up blanket. I'll show you both. With the wobble board, what we're going to aim to do is squats. So I slowly make my way onto the wobble board, feet hip distance and parallel. And then I'm just aiming to get the wobble board more or less neutral this is tricky. And once I've got that, my kind of low athletic stance, I can have my arms out for balance. It'll take a little bit of time for my nervous system to lock in on the pattern it needs to find stability. And then once I've got that, I'm going to start bending deeper. Oh my goodness, so challenging. And then holding. There we go. That's about coordination with many different segments of the body. The ankles have to get involved here. There we go. I'm just aiming to find stillness on the wobble board as best I can. Okay, showing you, if you're on there you can come off. I'll show you also the option with the rolled up blanket. So I'm just rolling it into a cylinder. And then I'm placing my foot right in the center, other foot in the center, feet hip distance, parallel. And I'm also just working on getting into a stable body position. And then just bending down into a squat position. Neutral spine. Activating my lateral glutes. And then just pausing here for a few cycles of breath. And then slowly coming up. We'll do that 2 more times. Either the wobble board if you like, or the rolled blanket if that's what you've got. Or you could start with a rolled blanket, get good at that, and then graduate yourself to a wobble board over time. So we'll aim for 5 cycles of breath here. Might be a bit of a rodeo, that's okay. 4 cycles of breath. Last one, coming up, and then off, shake out the legs. We'll do this one more time. Actually, I'm going to demonstrate with the chair, because I think I need it. So there's no shame in offering yourself an extra prop. It's not cheating, it's innovating. So I'm doing the exact same thing, but just with a little bit of extra help from the chair. Again, I want to prioritize good alignment over kind of a crazy rodeo. Over time. Yeah, it's funny, just having that there makes me like 80% more stable. Just knowing that there's something to catch me. Isn't that interesting? You can take your hand off, but it's there if you need it. Couple more cycles of breath. All right. Excellent work. Good job. Coming off of the wobble board, moving chair out of the way. Next, this is going to be a sequence of low lunge, hamstring stretch, lateral glute stretch, and a little bit of balance work. So we start at the top edge of the yoga mat, mountain pose. Inhale, arms overhead, and exhale, forward fold. Inhale, we come into our low lunge position. But this time, if you need a cushion for your knee, you can always use a folded blanket or fold the outer edge of your yoga mat. Now, because the pelvis is below the level of the knee, it's okay to go a little deeper in knee flexion, but I still aim never to allow the knee to protrude past the toes. Dropping the right side of the pelvis, lifting the left, lifting the torso. And just pausing here for a few cycles of breath. And one more. And now we're going to get creative. So I'm going to place my left hand down, walk the right foot towards the outer edge of the mat and turn the toes out, placing both hands to the inside of the right leg. And then just letting the weight of the pelvis sink down, I already start to feel pretty good stretch developing here. Now for bendy people, you may be able to come down onto forearms, but for most of us, you don't have to. Move within comfort, but on the edge of your current capacity. So if this is my 100%, I maybe go 102, and that's it. And now let's get interesting again. I'm going to walk my right foot in just a little bit, but now I'm going to roll onto the outer edge of that right foot. I want to make sure that I'm still pushing the big toe side of my foot forward, because that's going to help me keep the knee in a healthy alignment. But I drop the right leg out to the side, and I start to feel a stretch in the outer right hip. And then bringing that leg back up into low lunge posture. I'm going to move my blanket out of the way. I find for myself personally this works better if I put my body weight more on the area above the kneecap, and I don't need the blanket. That's just me personally though. I'm going to walk my right foot out a little bit, bend the left knee, and bring the heel towards the glute. Having a look back, trying not to have the foot in a weird configuration. I flex the ankle, and it's so funny how hard that is. There we go. Now, if you can, you could reach back with the right hand and then draw the heel in. But you don't have to go that far. And releasing. Coming back to all fours, bring the knees together and sink the hips down towards the outer edge of the mat. That one, that's a powerful sequence for the hip. Now you may be wondering why work on the hips if what our aim is for the class is the knees. Well, it turns out when things are going wrong at the ankles or the hips, that affects the health of the knees. Load will tend to go above or below a point of restriction. So we're going to come to the opposite side from this modified down dog. I step my left foot forward, right knee down. Again, feel free to use a blanket to cushion that knee if you need. And then coming into a really deep low lunge, dropping the left side of the pelvis, lifting the right side, and then lifting the whole torso so that I do not collapse into my low back as I'm in this deep lunge. So we've stretched the quadriceps, we're stretching the hip flexors, and then we're working on the lateral glutes in this sequence. By having healthy mechanics of the hip joint, It's much easier for the knee to track on a straight alignment. And then coming down, both hands to the inside. As we walk the left foot out to the left edge of the mat, turn the toes out slightly. Now find your 102% wherever that is. And then next posture, I'm going to walk the left foot in just slightly and then roll onto the outer edge of that foot, positioning my hands so that I'm not collapsing. And I push the big toe side of the left foot away from the knee. That creates more stability in the knee joint. And this will put the stretch into the outer left hip and at the same time probably the front of the right hip, the hip flexor. And then bringing that knee back up. I turn the toes out. Shift my weight into my right hand, and then I bend my right knee, perhaps reaching back and taking hold of the ankle. As you do this, you want to make sure that you're not torquing in the spine, you're not wrenching your back around. We lengthen the spine first, and then we rotate mostly in the shoulder girdle. I'm aiming to have straight alignment with the foot, drawing it straight in, so that if there's a line in the middle of my lower leg bone and my upper leg bone, they will be right on the same track. And then coming out of that pose, and as we return to all fours, I take the feet a little wider, and then I sink the pelvis down, arms forward, rest your forehead on the mat, and take a much deserved rest. And Balasana, child's pose. That, shifting onto one hip, and then rotating legs forward, just shake it out. Lastly, some spinal twist. We're going to do it in a slightly different way. Taking my left leg, I'm going to bend at the left knee and put my leg flat on the mat. And then I'm going to take my right leg, right foot to the outer edge of the left thigh. Now if possible, well, you could just wrap your arm around here, or if possible, hook your elbow to the outer edge of the right thigh. Right hand behind you. Lift, inhale, and then exhale, twist. Press the right foot down into the mat. You might notice a stretch somewhere in the underside of your glutes. Looking over your right shoulder. And then unwinding, uncrossing, and doing the exact same thing on the opposite side. It's called Ardha Matsyendrasana, which translate loosely to mean Lord of the Fishes pose. And like many of the names in yoga, inhale with the right arm, exhale, twist. there's a story behind it. And these are very, very old stories. You can look up Ardha Matsyendrasana, Lord of the Fishes pose, to learn what the story is for this posture. And then unwinding that pose, coming into Baddha Konasana, shaking the legs a couple times. So Baddha Konasana, cobbler's pose. Some people call it butterfly pose. And then we extend the legs straight. Come onto our backs. Feel free to use a blanket if you like. And then move into Shavasana, corpse pose, closing the eyes, resting the entire body. Let the breath be very natural. And feel the pressure of the back side of the body against the floor, starting at the bottom. Feel the backs of both heels pressing into the mat beneath you. And the back side of both calves. The back side of both buttocks. The tailbone. Feeling your mid-back against the mat. And the outer edges of your arms and the back side of your hands. The back of both shoulders. And lastly, the back of your head. With each exhale, feel as though you're getting heavier, sinking down into the mat. Getting a little heavier. And a little heavier. Relax completely. Letting this sensation of weightedness take over your attention. If the mind wanders, just bring it back to this sensation of the back side of the body melting into the floor beneath you. This is deep, deep rest. Wiggling your fingers and toes and stretching your arms up and overhead. Draw your knees up to your chest. Give yourself a good squeeze. And roll to your side to press yourself back up into a seated, cross-legged pose. That concludes our practice for today. Thank you so much for your attention and your focus. Namaste. Hariom. Tat Sat.